Welcome to Matters of the Mind. I'm Dr. Rick Adams, licensed psychotherapist, professor of psychology and human behavior. This podcast is devoted to helping you understand how the mind is shaped and influenced physically, psychologically, emotionally, socially, and spiritually. For more than 3 decades, I've been blessed with a front row seat into the minds of humanity. And now it's my desire to use that experience to help, aid, and assist you through this Matters of the Mind podcast. Today's Matter of the Mind topic, though, is one that cuts across every area of human life. So much so that through this series, I'll be conversating with other clinicians, counselors, psychotherapists, as well as psychiatrists, along with my current and former registered interns who are actively working in the field of behavioral health. Because this topic is one that I choose not to tackle alone. Today's Matter of the Mind topic is mental health. But instead of approaching it in the traditional way, I want to bring it into focus by asking and answering 3 critical questions. Where are we? Where we're headed? And where we're going? And now, to help me unpack this today, I'm joined by a special guest, someone who I believe is going to be a frequent flyer on this Matters of the Mind podcast. I'm being joined by Dr. Treshonda Baucom. And let me tell you a little bit about her. In 2018, Dr. Baucom's desire to impact and meet the mental health needs of her community led her to open up her own private practice. Dr. Baucom is a licensed mental health counselor, a professor. She's the founder and CEO of Enrich Life Counseling and Consulting, which provides counseling services to children, teens, adults, and parents. Dr. Baucom helps children, teens, as well as adults struggling with symptoms of ADHD, anxiety, and depression. Dr. Baucom provides parents with fundamental tools and resources to understand the developmental expectations and equip them to handle social as well as emotional symptoms that occur outside of the counseling session. She collaborates with clients, medical doctors, teachers, as well as caregivers to address the mental health needs of her clients. Dr. Baucom, welcome.
Thank you. I'm glad to be here.
I want to start and open up with this. Just let everybody know that she is one of my former interns, and she is doing some great things, especially in South Lake County. So can you tell us a little bit about your practice, and then we'll go into our topic of the day.
Absolutely. I am honored to be one of your former. That means I was trained in great hands. A little bit about Enrich Life Counseling. So I created the practice to be able to serve and meet the diverse needs. So cultural competence was a piece that I wanted to foster into my practice.
Excellent.
And so I wanted to have clinicians who may look like you, who may have similar experiences like you, to help eliminate one of those barriers, as well as a financial barrier. So we also accept insurance. So we service children, teens, adults, couples, the whole system. And we also work inside of some of our surrounding counties' public schools as well.
Okay. And just to kind of give them a better picture of you, you come from the school background, correct?
Yes.
Okay. Could you tell us a little bit about that?
Absolutely. So inside of the school, I was a pre-K ESC teacher. So I loved working with those who didn't fit your typical box. I have always been drawn to that. And I love the education piece about seeing someone's growth and potential from where they started and being able to be that one person in their life that sees their capabilities past what's on the surface. So I started in the school system inside of the classroom and then moved my way up into leadership and assigned like the MTSS behavior and school counselor designee. And then I finally got my degree and was able to open the practice and focus in on that.
Okay. I want to ask kind of a personal question, but not too personal in this sense. What's your passion? Because in this field, I always tell individuals that there's a career and there's a calling. And sometimes this is a career choice for individuals. And all I say to them is, if it's a career choice, just know when to get out of it. But when it's a calling, it's in you. Okay. And that calling is connected to passion. So can you give me us a little insight to what's your passion as to why you do what you do?
Yeah. Service has always been at the core
Okay.
of my heart. So whether that's serving my communities, serving the church, or serving individuals, a service component and a helping hand has always been at my core.
Excellent.
And so I've always gravitated towards helping the underserved.
Got it.
And
Got it.
so that is my passion.
Okay. Okay.
And that's what continues to drive me because
Excellent.
you do need a passion in this
You
field
do.
so
You
you
do.
don't
You do.
land in burnout.
And that's where I want to, as they say, I want to keep it real, okay? Because when I first started the podcast back, Cecily Wilson, who interviewed me, she said, "Why are you doing this?" And I said, "Because I need to keep it real because I want everyone to know where we are and what's going on, okay? But I didn't want to just give it from my perspective. I wanted to give it from a perspective of other clinicians and individuals in the field, okay? So that's why this series is topic is mental health, but it's coming from a perspective that's not traditional in the sense of we're not just going to talk about mental health areas of topics per se, but we're going to talk about where are we, where we're headed, and where we're going. So that's what I kind of want to land the plane right there. And since 2018, as well as up to now, okay, what are you seeing? Where are we, and what state are we in right now from your perspective when it comes to mental health?
I think we're in the state of awareness,
Okay.
meaning a lot of diagnoses or understanding of mental health are now being talked about,
Okay. Good.
which is probably the first step that it needs to be, where more people are open. You see different communities being open to
Yes.
hearing about mental health, to
Right.
receiving services and
Okay.
care. Um, and sometimes with social media, that can be a lot overwhelming on the helping side
Right.
because then the communication that they're receiving sometimes is not accurate.
Okay.
So we're at an awareness stage and knowledgeable. Um,
Give me some examples though of that. What you're seeing.
Um, well, you know what? There's this trending video going on social media right now of a not licensed person saying that mental health clinicians would only need to be licensed if
Mhm.
they want to diagnose or bill insurance. And I was just like, that's not
Misinformation.
true.
Misinformation.
But people latch on to that information and take it as truth.
Right.
So we don't
Right.
have a way to disseminate information, correct information without
Right.
filtering through the pieces that are false.
Correct. Correct. So with that being said, there's two things that come to mind. One is what are you seeing from a cultural perspective in regards to the awareness, and two, well, I'll save the second question for later. Okay? But what are you seeing from a cultural perspective when it comes to awareness?
So cultural, I'll say it's opened the gates, right? It's open communication lines on being able to at least recognize maybe this isn't so healthy. Maybe this isn't normal. Maybe we do need to talk about. And so on a cultural piece, it's opened the eyes of
Mm-hmm.
what we deem as normal or acceptable and being able to challenge and recognize and say, like, what do I need differently and seek help for those pieces.
And I'm also seeing that too, in that a lot more cultures, especially the African American culture, is more open to actually getting mental health counseling, and that stigma and that label is starting to decrease a little bit. Are you seeing that as well?
Absolutely.
Okay.
But sometimes with the stigma and label,
Mhm.
it can sometimes come as a crutch. Like,
Okay.
oh, I don't have to do the work because I have this. I'm like, that is not what that means.
Okay. Okay. Now let's go back to what you were saying earlier. I came across a case once, okay, where someone was presenting to me what's going on with them as far as the presenting problem, so to speak, and then they said to me, and I went to chat to see exactly what chat told me, and this is what chat told me about how to deal with this problem. Are you seeing that?
Yes. Yes. They let chat and social media diagnose them,
Uh-huh.
tell them what's going on.
Mhm.
Even in communication with friendships now, it's like they have to put it in there on how to respond now.
Okay.
And
Okay.
so all of their words, all of their knowledge is coming from something else. And I get
Mhm.
it. It's easier to externalize and put
Right.
things off on
Right.
someone else than to say, like, this is me.
Hmm. So what as a result of that though, what are the challenges then that you would say that we're seeing if they're doing it that way and as you said, kind of externalizing and not really doing the work themselves?
Yeah. Well, part of that is just really emphasizing what is the intention of therapy and counseling,
Got it.
because
Got
you
it.
have
That's
people
good.
that just come in and say, "Oh, I'm going to talk for one session and I'm
Mhm.
I'm fixed." I'm like,
Right.
"Wait
Right.
a
Right.
minute.
Right.
One, you're not broken. My job isn't to fix you, it's to
Mhm,
how to
mhm.
navigate and walk through this."
Excellent. Excellent.
Um and that counseling takes work. There are things that you would need to do outside of session to see the changes you want. And so
But
that
with that,
working
let me
piece.
do a little pushback. But I've been told I'm broken. I've been told that I'm sick. And I've had other counselors and therapists and other individuals tell me that I'm broken and I'm fixed, and not sometimes not even fixable. And now I'm hearing you tell me that I'm not broken, I'm not fixed. So when you encounter someone that is dealing with that, how are you able to approach them to break that cycle?
So sometimes I'll spin in maybe a little bit of act to understand what are their values so that I can get some buy-in. Sometimes I might just say, well, then why now? If this has been going on this whole time, why now? Why are you seeking help now?
Okay.
So that I can get to understand what a little bit of what that buy-in or that change agent possibly could be to keep them coming back.
Excellent.
But again, sometimes it's being able to say in the intake session, hey, this has been going on this long. Realistically, it is going to take me more than 4 sessions to
Excellent.
be
Yeah.
able to even understand the whole picture or conceptualize what's going on
Mhm.
and know the proper interventions or tools that we can work out for you.
Okay. Okay. And one of the things that when you say that that I've seen that's over the years since I've been doing this a very long time, insurances are now less likely to some extent to cut you off after 12 sessions. Okay. Whereas after, we were given 3 months. After 3 months, you're supposed to have them, everything is good and they're healed and everything. But now I'm seeing that we're not, society's not necessarily pushing for that, that it may take 6 months, it may take a year. And with true trauma, and this is what most people don't understand, that when you're dealing with a true trauma client, that trauma and traumatic experience may have impacted them for years, 10, 15 years. So it may take a year, 2 years, and sometimes 3 years of therapy to really deal with that.
Mhm. Absolutely.
And the other thing too is I often present to people that there's a difference between counseling and therapy. Okay. And counseling is guidance and direction. Therapy, though, is like surgery, where you really have to take time to go inside of a person and deal with some of the things that he or she has really not dealt with. Okay. So when it comes to that, where are we going as far as going really helping people go really deep in those traumatic episodes and experiences that they have?
So for me, I think one of the pieces also is understanding from a clinical piece, like
Mhm.
how to work with the trauma,
Okay.
because I do find that unfortunately sometimes through experiences with therapy, you may get a clinician who says, "Yes, I can work with that," but
Mhm.
they don't have the necessary
Excellent. I'm glad you said
tools
that.
and skills to be able to work with that. So even as counselors, I feel like it's our job
Mhm.
to work within our scope and to know like what point can we get someone to and then say like I can handle this piece,
Right.
but you may need to go here for that piece.
And that's good because it's not, we don't want to be a one-stop shop, I find that whenever I do work with in terms of individuals, I'll say, okay, when you've reached your scope or when you've reached what you can do, there's nothing wrong with referring out. There's nothing wrong with being able to help them go to somebody else, because you don't want them to be so dependent on you. And I've seen that a lot over the years, so where individuals become so dependent on their therapist or their counselor that they're not able to do the work all on their own.
Yes,
So,
that
and as far as children and teens, what are you seeing there? Where are we when it comes to our young people?
I love our young people. They have a special place in my heart.
Okay.
I love our young people, but I would say again, they are very open, right? But that immediate need for fixing or
Hmm.
for understanding,
Hmm.
and not wanting to do the work to fix it.
Got it. Got it.
But when you work with young people, in my expertise, I think it's so systematic, right?
Okay.
So at my practice,
Explain that.
I won't work
Okay.
with a child and not work with their parents.
Excellent.
because there are
Excellent.
factors that maybe that relationship is influencing this to continue, and somehow it's feedbacking off of each other. Um, and sometimes parents don't like that. Like, no, I'm bringing them to you. I'm like, wait,
I, I
wait.
used to see that when I used to go work years ago. I used to work at a runaway shelter. And the parents would say, okay, I'm dropping them off. When I come back to pick them up, I want them to be fixed
Yeah.
after 7 days, and that philosophy that you're talking about is so necessary, that we understand that it's not the kids, and the analogy I would give is this. I said, if you have a car and all four tires are flat, what are you going to do? Just change one of the tires? Or are you going to change two of the tires? What's going to have to happen? You got to change all four tires. And I'll literally say, all this family's flat. All of your four flat tires. So it's not just your son or daughter that has to change. It's you that has to change as a parent. Dad is also you. Mom is also you. And getting them to see that it's not just changing this one tire, aka changing this one child, that's going to help this family or stop this family from working. It's going to actually take all of them being changed. So now, when it comes to relationships and marriage and things of that nature, where are we from your perspective?
So when I think of a couple, you have two individuals coming to be as one, right? You have two individuals who have gone through their own experiences and sometimes not dealing with their own experiences. So when you combine that, it then comes to the surface and you both start triggering each other,
Hmm. Hmm.
um, opening up those wounds because maybe you did a little counseling and not the surgery. So
Correct. Correct.
it's easy to take off that band-aid and the wound is still there.
Hmm.
Um, and so I see that again, there is a willingness to still want to belong together, but do they have the desire to put in the work
There you go.
necessary? Because
There you
maybe
go.
social media says like, no, this should automatically happen.
Correct. Correct.
And or if I say it one time, that should suffice and be enough.
Hmm. This is another one I use. Your present problem is usually not the source of your present pain. Your present pain is usually rooted in your past. And when you have two people with a past and they fail to deal with that, it's going to bring about present problems. And a lot of individuals in relationships, as you said, they don't want to do the work. But I find out though that they sometimes, in not doing the work, will focus on other things. And those other things that they thought would actually help them, getting the focusing on the job, focusing more on traveling, those surface things, come to find out that those things are not going to, for lack of a better word, not going to suffice when they really deal with some of the tough issues. Okay. Um, with that being said, help me out when it comes to, and I also wanted to, and I think I mentioned this to you before, I want to also talk about, just from a gender perspective, when it comes to women. Okay. What are you seeing that women are dealing with as well in your practice, as well as throughout the years, that can give them some insight, or me some insight as well, as to what women are dealing with and where are we when it comes to women in counseling as well.
Yeah. I think with women, it breaks down between a separation of what society deems a woman should be or should be doing versus what you're actually doing. And sometimes those conflict and compete. For example, I see a lot of entrepreneurs or really affluent women who
Mm-hmm.
don't fit the typical stay-at-home mom, but they have families and have a desire to do things outside. Or someone, I also see women who wear the cape still,
Mm-hmm.
right? They do everything, they're superwoman, but they're burning out on that.
Excellent. Okay.
And so I think balancing between all of the roles
Mm-hmm.
and understanding that you can't give 100% in all of those roles, but a woman wants to give
Right.
100% in
Right.
all of
Right.
those areas. And so learning how to live life each day when you have a extreme amount of anxiety or overwhelm or stress,
Okay.
or a desire to do something differently for yourself.
And with that being said, this is one of the things that I present when I'm working with female clients, that you and I do a lot of an analogous therapy. Okay, I say, okay, you drive in three lanes. There's your woman lane, your wife lane, and your mother lane. Okay. And in that woman lane, you have wants, needs, as well as desires. And then also in that woman lane is that little girl, is that teenage girl, are those things that's happened to you in your life. But then there's also the wife lane. And in that wife lane, as a woman, you are a wife, but you've also chosen now to get married. So now you got to drive in the wife lane. And every woman also is a mother. But when you have kids, you now become a mom. So now, as a woman, as a wife, and as a mom, aka mother, you now have to drive in all three lanes. All three lanes. And that's not to mention having to now deal with everyone else in those lanes. Okay. When it's presented in that way, what would you say can help those women maneuver in those lanes? Because you can't drive in all three lanes at the same time.
Mm-hmm.
Okay. So how would you, and what would you recommend to help them to be able to drive in those lanes without crashing?
Yeah. I always like to start off like understanding them. Like, what does it mean to be a woman for you?
Okay.
Right. So I can understand again from an act perspective, like what are your values? What are you working towards? Because I can kind of see if your actions, thoughts, and behaviors are going towards what you value or moving away. Because if we're moving away from it, that's going to cause conflict.
Okay.
And so I would go through that. What does it mean to be a wife? Or what does it mean to be a friend? What does it mean to be this? So I can understand from their world what they're wanting, and then what we're currently doing, how that separates or how it's not meeting that.
Okay.
And I think one of the things I always remember about you is you taught me how to understand and clarify my roles and what I'm showing up as.
Good.
So I don't know if you remember, you used to always say like, I'm your pastor right now, or I'm your supervisor right now.
Yeah.
What hat you're wearing. And I find myself saying that all the time. Like right now I'm your boss. Right now I'm this.
Yes.
And
yes,
it has helped because it also unintentionally frames for me who I'm showing up as right now, because all those pieces of me are very different from each other. Like I call myself Simone on one hand. That's the fun, like let loose. And then Dr. Baucom's the serious, like, oh, you got to present yourself.
Treshonda.
And all of those things, right? When you think of a person, all of those parts can be a part of you. You don't have to just choose one.
Right. Now, and let's keep it real. What about though when you are that woman and the role models that you've had though have not been the best? When you're trying to be that wife, but you've seen other individuals that you maybe not even modeled after, but just saw growing up, and what they did, you saw what they did right, but you also saw what they did wrong. And you also, what if you were also that woman who saw, as a wife in that wife lane, you saw your mom in that lane with domestic violence or with drug. There's so many things that can impact a woman in those lanes. And that's why I say in that woman lane is also that little girl who may have had some experiences that she's never dealt with. And now she's trying to not focus on that woman lane of what happened to her and then drive in that wife lane. But yet what she's seen in that wife lane is in some cases abuse. Okay. But then you also trying to have her in that mother lane of being a mom. And again, the examples that she saw are not the best. Okay. So when you encounter individuals like that, or when you're helping someone, or even from a personal perspective, how do you help them maneuver through that? How do you help them navigate through that? Because that's one of the things that I see, as you just said, that women trying to put on those hats sometimes can be difficult, so to speak. So how can we speak to them and help them with that?
I think some of it also just comes from understanding their story too.
Okay, good.
I like to think of like a web, right? A web is all of these different experiences, all of these different thoughts that combine into one, and they're mixed up.
Okay.
And I don't know if you've ever been in like Boy Scouts or Girl Scouts, you know, when they have the knots, but then you have
to. I did the sports. That's about it. So
you have to untie these complex knots. And sometimes in therapy, I think it's understanding those knots and being able to unravel them where it's smooth and not tangled anymore. And understanding like we learn through our experiences, we learn through behavior, and we don't get the choice always to choose who our parents or what experience we got exposed to. And sometimes we're not even aware of the impact it's had on us. And so sometimes it might be in counseling or therapy that it's like, I didn't even put those two together.
Correct.
I didn't
Correct.
know that
Yep.
this was in relationship to this. That happened at 2 years old. And now I'm
Exactly.
45.
Exactly.
And so I think sometimes just that aha moments or that relation and the normalization of,
Right.
it's okay that this happened, but you do get to choose what you would like to do with it now.
And you got to be willing to do the work, though.
Yes.
You got to be willing to do the work, and because this is not a next day series, so to speak, that after you just do it one or two times and then everything will be great. Okay.
Yeah.
And I mean, there's so much more that I would like to talk to you about, and this is why I say you're going to be a frequent flyer on Matters of the Mind. So I look forward to having this conversation again, because there's so many things that we're talking about that I believe that individuals need to know about. So be ready to come back to Matters of the Mind. Is that
I'll
okay?
be here.
All right. Excellent. Thank you.
You've been listening to Matters of the Mind, a podcast that focuses on matters that affect the mind. I'm Dr. Rick Adams, licensed psychotherapist and professor of psychology and human behavior. Come, join me on the couch as we discuss matters dealt with, matters dealing with, and the matters that we avoid.